Did you know? Most people think heart problems happen suddenly. One day everything seems normal, and the next day they hear news about heart disease or a heart attack. But the truth is often different. In many cases, the body gives warning signs much earlier. The problem is that these signs seem very common at first, so people ignore them and think they are caused by tiredness, gas, age, or a busy life. The heart is an organ that never stops working. It pumps blood through the body day and night. Every part of the body depends on the heart to stay alive. When the heart starts working under extra pressure, the body may give warning signs in different ways. The good news is that many of these signs can appear early. If people notice them in time, they may be able to take action sooner. In today's video, we will talk about 7 important signs that can appear before heart disease. Many people think these signs are normal and ignore them. At the end, we will also learn who should pay the closest attention to these warning signs. So, what is the first warning sign that may happen before heart disease? One of the first signs can appear even before chest pain. That sign is getting tired very easily. A person may start feeling more tired than before. For example, you may have climbed stairs easily in the past, but now you get out of breath. Walking to the store may have felt easy before, but now it makes you feel tired. You may even feel low on energy before the day is over. Many people do not think this change is important. They believe it is because they are getting older. They may think they are working too hard, or that their body is simply changing with age. Sometimes that is true, but sometimes the body is trying to send a warning. The heart works like a pump. Its job is to send blood all around the body. This helps every body part get oxygen and nutrients. If the heart has to work harder than normal, blood may not reach all parts of the body as well as before. Because of this, a person may feel tired more quickly. This can happen during normal daily activities. Many people think chest pain is always the first sign of heart disease. But for some people, the first sign is different. Things that were easy before may start to feel harder. This can be an early warning from the body. Remember one important thing. Feeling tired does not always mean heart disease. There can be many reasons for tiredness. Poor sleep, stress, low iron, low vitamins, or other health problems can also cause it. But if your energy keeps getting lower, and normal tasks become harder than before, and if other warning signs are also present, then this change should not be ignored. Heart disease often gives several small warning signs, not just one. Another warning sign is shortness of breath. Many people do not connect this sign with the heart. They may think they gained weight, became less fit, or are getting older. Sometimes those reasons are true. But sometimes the body is warning about a heart problem. When the heart pumps blood properly, oxygen reaches all parts of the body. This helps a person do daily activities more easily. But when the heart is under extra pressure, the body has to work harder to get what it needs. Because of this, some people start breathing harder during normal activities.
For example, while climbing stairs, walking fast, carrying groceries, or even while walking a short distance.
At first, this change may seem very small. Many people do not even think it could be a health problem. Over time, this change becomes easier to notice. For example, you may have climbed to the 2nd floor without stopping before, but now you may need to stop and rest halfway. It may have been easy to walk to the store before, but now you may feel out of breath more quickly. These are small changes that many people ignore. This happens especially with men. Many people think it is only because they are getting older, but sometimes the body is trying to give a warning. Some people also notice breathing problems more at night. Others may feel uncomfortable when lying down. Changing body position can sometimes make these symptoms easier to notice. Remember one important thing. Not every case of shortness of breath means heart disease. There can be many other causes. High blood pressure, lung problems, extra weight, or poor fitness can also cause breathing problems. But if shortness of breath happens along with tiredness and other warning signs, then it should be taken seriously. Heart problems often do not happen all at once. The body usually gives small warning signs first. Now let's talk about another well-known warning sign. Even though many people know about it, they often think it is only gas, indigestion, or tiredness. Chest pressure or heaviness can be an early warning sign of heart disease, but it doesn't always feel like the dramatic pain shown in movies. Many people describe it as a heavy weight on the chest, mild discomfort, or dizziness, and often mistake it for gas or indigestion. Sometimes it's harmless, but sometimes it's your heart trying to warn you. Let's understand it in a simple way. When the heart does not get enough blood and oxygen, some people may feel discomfort or pressure in their chest. At first, the feeling may last only a few minutes and then go away. This can make people think nothing is wrong. The feeling may come and then go away on its own, but the body has already given a warning. Here is another important thing to remember. These signs are not the same for everyone. Some people may feel pain, while others may only feel pressure. Some people may simply feel uncomfortable or feel that something is not right. The feeling may come and then go away on its own, but the body has already given a warning. Here is another important thing to remember. These signs are not the same for everyone. Some people may feel pain, while others may only feel pressure. Some people may simply feel uncomfortable or feel that something is not right. Remember this important point. If you have severe chest pain, trouble breathing, or pain that spreads to your arms, jaw, or back, you should get medical help right away. These can be signs of a serious emergency. In this video, we are talking about the early warning signs that many people ignore because they seem normal. The next warning sign is interesting because it is not always felt in the chest. It can appear in other parts of the body. These areas include the neck, jaw, shoulders, and arms. This is another warning sign of heart disease that people often overlook. It can be pain or discomfort in the neck, jaw, shoulders, or arms. When someone has pain in the neck or shoulders, most people think of other causes first. They may believe it is from sitting the wrong way, tired muscles, or back pain. Often, those are the real reasons, but sometimes the cause can be something more serious. This can make heart problems harder to recognize. Heart problems do not always cause pain only in the chest. Sometimes the discomfort can be felt in other parts of the body, such as the left arm, shoulder, neck, or jaw. Many people do not take this pain seriously at first. They may think they slept in a bad position, have a sore back, or simply worked too hard. So they continue with their normal daily activities. But the body may actually be giving an important warning. Why can heart-related pain be felt in the arm or jaw? The answer is simple. Our nerves send messages from different parts of the body to the brain. Sometimes the brain cannot tell exactly where the pain is coming from. Because of this, heart-related pain may be felt in other areas. Some people may feel pain in the left arm along with chest discomfort. Others may feel pressure in the jaw or discomfort in the neck. This is especially important if it happens while walking or along with chest pressure. If this happens, it should not be ignored. Here is another important fact. Some people have very little chest pain. Instead, they may have more pain in the arm or jaw. This is one reason why some people miss the early warning signs. Remember this important point. Not all neck or shoulder pain is caused by heart disease. Most of the time, it is related to muscles or joints. But if it happens along with tiredness, shortness of breath, or chest pressure, and there is unusual pain in the neck, jaw, or arm, it could mean something more serious. This is when it is important to pay close attention to your body. Now let's talk about another warning sign that can be very easy to miss. Many people think it is only a stomach problem. Some people do not connect it to the heart for many years. This sign includes dizziness, indigestion, or discomfort in the upper stomach area. It is one of the most misunderstood warning signs of heart disease. The sign can be dizziness, indigestion, or an uneasy feeling in the upper stomach. If someone feels dizzy or has a burning feeling between the chest and stomach, they usually think of something else first. Most people think it is gas, indigestion, or food-related discomfort, and many times that is the reason. But sometimes the body is warning about a different problem. This is one reason why some heart warning signs are often ignored. In women, this sign can sometimes be more noticeable than chest pain. Some people say they felt dizzy, their stomach felt upset, or they just did not feel well. They may also feel discomfort in the upper part of the stomach. Because these feelings seem related to the stomach, many people do not take them seriously. So why can a heart problem feel like a stomach problem? Let's understand it in a simple way. The chest, heart, and upper stomach are very close to each other. Because of this, heart problems can sometimes feel like indigestion or stomach discomfort. This can confuse many people. If chest pressure, shortness of breath, or unusual tiredness happen at the same time, then it should not be ignored as simple indigestion. Another important thing is that some people notice these symptoms after physical activity. For example, after walking fast, climbing stairs, or exercising. They may start feeling better after resting. This pattern can give important clues. Remember one thing. Not every case of indigestion means heart disease, and not every heart problem causes the same symptoms. But if these symptoms happen again and again, and other warning signs are also present, then they should not be ignored. The heart often gives quiet warning signs. Understanding these signs can be very important. Now let's talk about the next warning sign. It may seem very common, but it can sometimes be an important sign of heart disease. That sign is unusual sweating. Unusual sweating can be another warning sign of heart disease. Many people do not connect this sign with the heart. That is because sweating is very common. People sweat during hot weather. They also sweat during exercise or hard work. But here we are talking about a different kind of sweating. It happens without a clear reason. For example, you may be sitting comfortably. The weather may not be hot. You may not be doing any physical activity. Yet suddenly you start sweating a lot. Some people describe it this way. Their whole body suddenly becomes covered in sweat. They may even have cold sweat. They may also feel strange or uncomfortable. The sweating happens along with that feeling. This is something that should not be ignored. So why can heart problems cause sweating? Let's understand it simply. When the body feels that something unusual is happening inside, the nervous system reacts very quickly. In some people, this reaction causes sweating. This can happen when the heart is under extra pressure. That is why some heart patients later say they noticed unusual sweating before or during chest discomfort. Here is another important fact. This sign can sometimes be more noticeable in women. Many people think it is caused by heat, weakness, or hormone changes. Because of that, they may miss the real reason. Now think about this. A person gets tired quickly. They feel weak or exhausted. They have pressure in the chest. They are sweating. They also have unusual sweating for no clear reason. In this situation, the body may be giving the same warning in different ways. This is the stage where the signs should not be viewed separately. Instead, they should be looked at as one complete picture. Remember one important thing. Not every case of sweating means heart disease. Fever, anxiety, some medicines, or hormone changes can also cause sweating. But if the sweating is unusual and other heart warning signs are also present, then it should be taken seriously. Now we have reached the most important sign on this list. It is one of the clearest early warnings of a heart problem and may be the first sign some people notice. It is an unusual feeling in the heartbeat. This may include an irregular heartbeat. It is one of the most important warning signs. It may feel like your heartbeat is different than normal. Some people say their heart feels like it is beating in a strange way. Many people describe it like this. Their heart suddenly beats very fast. It may feel like the heart skips a beat. Then it suddenly starts beating quickly again. Sometimes the heart rate increases for no clear reason. Because this feeling often lasts only a few seconds or minutes, many people ignore it. But sometimes it can be an important warning sign from the body. So why can the heartbeat change? Let's understand it simply. The heart is not only a pump, it also has an electrical system. This system helps control the heartbeat. Special electrical signals are created in the heart. These signals help the heartbeat in a steady rhythm. If this rhythm changes, some people notice unusual heartbeats. Sometimes the heart beats very fast. Sometimes it beats unevenly. Sometimes it feels stronger than normal. Here is another important fact. Some people think this is only caused by anxiety, and sometimes that is true. Anxiety can make the heart beat faster. But if the heartbeat changes often, if you feel short of breath, if you get tired easily, or if you feel pressure in the chest, then it may be more than just anxiety. That is why these signs should not be ignored. This is especially true if the symptoms are new or are becoming more frequent. Now, let's look at the big picture. Before heart disease develops, the body may give warning signs in different ways. You may get tired quickly. You may feel short of breath. You may feel pressure or heaviness in the chest. You may feel pain in the neck, jaw, or arms. You may have indigestion or stomach discomfort. You may have unusual sweating, or you may notice changes in your heartbeat. The interesting thing is that most of these signs look like common, everyday problems. Because of this, many people ignore them for months or even years. But the body may be trying to send a message. This brings us to an important question. If someone notices one or more of these signs, what should they do? And who is most at risk for heart disease? Here is an important question. If a person has one or two of these signs, does it mean they definitely have heart disease? Not always. Many of these signs can also be caused by other problems. For example, tiredness, stress, lack of sleep, lung problems, or other health conditions. The important thing is to look at the pattern. Watch how the signs appear over time. If the body keeps giving the same warnings and the symptoms become more frequent, they should not be ignored. This is especially important for people who have a higher risk of heart disease. These include people with high blood pressure, people with diabetes, people with high cholesterol, people who smoke, people who are overweight, and people with a family history of heart disease. For these people, paying attention to the body's warning signs is very important. Listening to these signs may help detect problems earlier. Remember this: heart disease does not always happen suddenly. It can develop quietly over many years. During that time, the body may give warning signs in different ways. One more important thing: many people wait too long before seeing a doctor. They wait until the pain becomes severe. But sometimes, finding heart problems early can make a big difference. If you keep feeling pressure in your chest, shortness of breath, unusual heartbeats, or several warning signs together, it is a good idea to talk to a healthcare professional. Interestingly, most of these warning signs seem like normal, everyday problems. That is why millions of people ignore them. But the body often gives warnings before a serious problem happens. It starts sending signs early. The important thing is to recognize those signs. This may be the most important message of today's video. Heart disease usually does not appear overnight. In many cases, the body gives warning signs first. People who notice these signs early can often make better health decisions. If you learned something new today, please share this video with your friends and family. You never know. This information may reach someone who truly needs it. If you enjoy simple, helpful, and trustworthy health videos, do not forget to subscribe to the channel. Take care of your heart. Do not ignore your health. Learn to listen to your body's warning signs. Thank you for watching.